What's up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for September 28, 2020. Rethinking School Closures in COVID-19. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to education professor Annette Anderson and bioethicist Ruth Faden about schools and how the COVID pandemic has and will continue to impact learning and so much more. Let's listen.
Annette Anderson and Ruth Faden, thanks so much for joining me.
Thank you for having me.
My pleasure.
Annette, I'd like to start with you. Today we're talking about schools and what happens when schools aren't open and the kind of issues that can cause. And we're about to see a lot of that unfold in the next few weeks and months. So I wanted to talk a little bit about sort of the quality of online education that we're seeing from what we saw in the spring, what we might see in the fall. I'd love to hear your thoughts on that.
Yes, thank you, Stephanie. Well, I'd start by saying hopefully as we go back in the fall, schools have had an opportunity to really expose teachers to some professional development to support them in delivering online instruction. So whether a school is going back in face-to-face or hybrid or in totally online way, I think that we need to make sure that teachers are having the type of professional development that will help them just really scaffold students throughout this year. This is going to be an academic year like any other. And so I think teachers, wherever they are, public or private, they need to be exposed to good instructional strategies to maintain rigor in the classroom.
Have we seen that in public schools? Have they been learning how to do this?
There are some schools that are well ahead of the curve because they invested mightily in technology early on. They are some of the districts that have a one-to-one policy for students. And so the technology that they've been able to provide to their students as well as to their staff have allowed them to really keep going with instruction without missing much of a beat. The concern, however, is for those districts that have not had the resources to invest as well as some of these larger districts and more wealthy resource districts that could do this and start in this way.
And it's not just having the resources. I mean, it's also knowing how to use them the right way. I mean, I know my kids had devices and they also had teachers who really couldn't be bothered to teach them much.
Yes. So, and I think that's a function of professional development. So I think where you've had some vision in the leadership at the district level, they've been trying to provide those supports for teachers. What we found, though, in some of our less resource districts were that many of the teachers themselves did not have access to high quality devices and high quality internet. And so it became an equity issue as well for those students because their teachers did not have access to get them up to the same level as some of the students in wealthier districts. So it's a challenge on many, many fronts to think about this.
Ruth, I wanted to talk to you about those equity issues. One thing that I've been noting is that, for example, where I live in Baltimore, all of the public schools are closed. They'll be doing online instruction starting in the fall, and many of the private schools are open. So it feels like we're going to really exacerbate this whole have and have not situation.
That's exactly right, Stephanie. So any way you think about how things were in before times in terms of questions of equity, whether it's between private, public, well-resourced public and poorly resourced public, rural and urban, low income and middle and high income, children of color, children of privilege, however you slice it, there were inequities before. And for all the same reasons that there were inequities before in achievement and in development and in graduation rates, and we can go through a bunch of metrics, right? For all of those same reasons, things have gotten a lot worse now because of the school closures, and they will widen. They've already widened and they will widen more. And that is just a terrible tragedy unless we take huge steps right now, at least to put a very solid floor between our most disadvantaged kids.
Mm-hmm. I don't see a lot of work being done in that direction. Please correct me if I'm wrong.
Right. So there's a lot of discussion. There's a lot of energy. You gave the example of private schools versus public schools. And it's true. It's the well-resourced private schools, the sort of parochial church-based schools that are not particularly well-resourced, I'm guessing, are also facing some of the same challenges that public schools are facing. But if you take a well-resourced private school, they have a whole bunch of stuff they can do. And they can be nimble and they can be agile, and that's all great. At the other end of the spectrum, you've got a poorly resourced school that's serving children who are living primarily in neighborhoods that are disproportionately poor, right? And you've got everything running against you. So what can you do? Well, and I'll ask Annette to chime in just a moment, but think concretely of the sorts of things that more affluent parents can do, or at least, if not affluent, sort of better resourced parents can do in terms of the efforts now to create little mini pods for their kids and to form collectives and hire older students or teachers or tutors or something to approximate both the educational experience that occurs in face-to-face learning and also the social and developmental learning that occurs in school. Well, if people of more means are able to organize themselves to do that for their kids, and it's a phenomenon we're watching and we don't have numbers yet as to how widespread it could be, why couldn't community groups and schools and churches, and you can go down the list of civil society, do something similar for children whose parents are not positioned to be able to organize in that way on their own? Just because buildings are not being used for face-to-face instruction doesn't mean that the school building has to be completely shuttered. Couldn't we think of creative and safe ways to provide something to put that floor under our kids who have the least now and will have even less, right, going forward?
Annette, I see you nodding your head.
I believe in that wholeheartedly. I've said often that schools are both buildings and they are a collection of experiences. So I think Ruth has hit the nail on the head with this. I believe that even though we have virtual learning in many districts, I think 55% right now of urban districts have already declared that they're going to be virtual for the fall. We know that those buildings still play a huge role in the lifespan of the entire family. So we should keep those buildings in use. We should open them up so that you can have school-based health centers that are still open for families, so that dental clinics can still be available to children, so that small groups of children, such as children who may have special needs, can come in and get their services in person. So while the building may be physically closed for day-to-day instruction, we think that the school is a huge space for learning and for family connection to happen. And so, yes, I do agree with Ruth that I think a lot of opportunity exists in us thinking about how we can use schools in new and different ways. The community school movement has made that really clear, that schools serve a huge purpose for many families in less resourced areas of our country. But I think that, thinking about innovative ways to put additional resources like housing access and health access and food access. Some schools took some of those up in the spring when schools closed, and I would love to see those kinds of services be expanded in every school across the country.
So with online learning, I know that, or at least in my personal view, you all are the experts, right? So what I see with my own children is I feel as though they're not learning as much, and there's a lot of room to not engage, right? I'm worried about and that's just my own very, very small N of 2, right? So the lost learning, I'm worried about that. And I'm wondering what you're seeing or concerned about seeing for children going forward in terms of what this time away from the classroom could mean long-term.
Annette, you want to take that one and then I'll follow you?
Well, I was just going to say that I do think that we need to have some means to assess student learning when students return in the fall. so that we can try to figure out and have a benchmark for our students in terms of their learning going forward. We don't have much information right now to confirm our suspicions around learning loss, and we really need to have a national perspective on that so that we as educators can pivot there. I will also say, though, that I think that a lot of parents are also concerned about the social emotional pieces of this continued virtual learning.
Very much, yes.
Yes, and that has been the driving force for many, not actually the academic pieces. I think there are a lot of people that think that it's the SEL pieces for students that need to be just really sorted out in this virtual environment. And I think that schools are trying to attend to that. I think you see some schools that are trying to still have some kind of after-school clubs and have some additional extracurricular sports and activities and smaller groups in schools. And while that does carry still some risk, it is a lower risk than having a school full of students at their normal numbers. Ruth?
So just to follow on, and that's completely right. We don't have the metrics and we need to get them. There have been attempts to project. McKinsey came out with a report early in June, and they projected out how much learning loss there would be under a scenario which now seems sort of laughable. I mean, one of the scenarios was, okay, we'll all be back in school in the fall. What would that look like? And their predictions there were pretty dire. Now you extend out, they also had a scenario where it would be, all right, we'll be hybrid, in the fall for some kids, and who knows what's going to happen when it looks like we're going to be shuttered completely in so many school districts. A couple of things on online learning. We know, right, there are online academies, have been online for a while, pre-COVID, that provide what appears to be really high quality education to children online. Some of these academies are geared to actually gifted kids. And it's quite remarkable. So that stands off in a corner somewhere. Just because it can be done doesn't mean that it will be done. Also, those schools have been at it for 5-6 years, in some cases 10, to try to kind of get it down. What we need to be thinking about is what's going to happen. We're going to have, when there's a part or whole online, there will be some children who will get kind of a decent online experience, right? There'll be some kids with less learning loss. There'll be some kids who will get right, online education with more learning loss. And then there'll be some kids, whether online education is offered to them or not, who will not engage, right? Who will just not show up, who will not be there, right? And you can imagine how that will track family income, parental education, geography, and a bunch of other things. So we can predict without having the metrics sort of how this is going to fall out, right? On the other hand, we really need the assessments to be able to put a pin on it in a way that policymakers need to see it, right? They need to see the data, right? They need to see the impact, the dropout rate, which is something I'd love for Annette to speak to, but we're in our work together deeply worried about children in 9 through 12 who are just going to say, forget this, what's the point? And we know what happens in terms of the life prospects for children without a high school education. We know what that does for the national economy, but we know what it does for the wealth of groups in this country. There are all kinds of reasons why we have the gaps that we have in wealth and income, and not the least of which is the sort of cycle of high school dropout that's a result of many multi-causal factors. Now we're adding something else, right? Another reason why kids will leave school. Again, we don't have data on this yet, Annette, but we know what was the dropout rate before COVID, in before times, already unacceptably high in some communities.
Mm-hmm. It was over 10. It depends on the community, but around 10%. That's why I think I would just say that you have to have, in addition to this virtual instruction, you're going to have some experiences for students so that they can feel engaged in the life of their school. So I think when schools, remember, when schools reopened virtually in the spring, it was in response to an emergency. It was a national emergency. And that emergency continues until we can get the transmission rates low enough to go back into the buildings. But what I think is really powerful is that some schools have begun to try to adapt the experiences around the school and around the instruction so that students are not just thinking about their physics course or their English course, so that they are thinking about the life of being a student in addition to the academic pieces of school. And that's going to be really important because, Stephanie, the thing people have to realize is that we have permanently disrupted public education writ large as we know it. It is disrupted, and we have to accept that. We have to mourn it, but I think we need to be able to accept it because there's been a lot of innovation that has started to creep up around it. And that's a great thing for our students, but we need to know what those disruptions are so that we can start seeing how the innovation is impacting students. Some students didn't go back to school physically, and they were fine academically. So we have to also think about how every student is not a monolith, and we have to think about how we program and plan for the multiple myriad experiences of students everywhere.
Stephanie, if I could just follow up, well, I'll do it quickly. One of the things I think it's really important to understand is how totalizing the experience is for children of not being in a school building. This is not to say that they should be right now. Again, and that's caution about we cannot open schools when the community-acquired infection rates are unacceptably high. But it's every aspect of a child's well-being that is set back when they are not in school. So if we focus only on instruction, which is terribly important, we are missing lots of other pieces of the prize being the welfare of our kids.
Mm-hmm. And I will say that I really noticed the issues around the social development, and I think that I guarantee that my children miss the socializing way more than they miss any of the academics.
But I think for every student, it is different. I noticed that my daughter, who's had eczema for years, suddenly within 3 weeks of school closures, she's not had eczema for the last 4 months. So it's been interesting because I didn't even know in my own child that my own child was having school-related stress over grades and performance and girl stuff and all the stuff that happens in school. And she misses her friends, but the eczema has gone away. So, I don't attribute that to any, thing that's a huge part of this school closure piece. But I do think that for every student, they experience school closures and they'll experience school reopenings very differently.
Ruth Faden and Annette Anderson, thank you both so much for joining me.
Thank you for having me, Stephanie.
Pleasure, Stephanie.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.